Hey guys, how's it going? Today I want to talk about lower body tightness and aches and pains and how to deal with it so that you can train better, so that you can go about your day, not just in the gym but outside of the gym, and feel like you have the ability and the strength, and you're not going to be in pain, you're not going to be aching, you're not going to be having issues with your activity and your activities of daily living. So oftentimes I might hear somebody tell me that they have some knee pain, they have some low back pain, or some hip pain, and we can't really figure out what it is. They can't really pinpoint it. It probably, they feel like they're doing everything right. They're training hard, they're working out regularly, they're, staying active, they're moving. And the thing is that we want to look at kind of three different things overall. First one is we want to look at what you're doing on a daily basis and your posture, okay? Your posture, both just standing here upright from the side, from forward, and then your active or dynamic posture of you moving through, your functional posture, of you moving through exercises or moving through the regular activities of your day, whether that's picking something up. We want to make sure that your body is moving properly and keeping itself in the proper posture, okay? What happens in our typical lifestyles, and what I notice most commonly, is that the people that come to me and say that my knee hurts, my hip hurts, I'm getting sciatic pain, I'm having back issues, and these all came on, seemingly out of nowhere, is that we are in the improper postures. Our bodies don't like being in a seated position. They don't like sitting for long periods of time. They don't like being in a tight closed position. They like being active and moving. So what happens is that if we sit at our desk, or if we're at our phone or computer and we are hunched over, what happens is that if we're sitting down, we end up shortening and tightening up those hip flexors. We don't use our abs, so our abs aren't working. We don't use our glutes, so our glutes aren't working. So those are both weak, abs and glutes. And your whole core. And then we get tightness in our back. What else happens? There's a muscle called your IT band, your IT band, your TFL for short, too. That all crosses between the knee all the way up to the hip. So if that is in your seated position and then you go to stand up, you're going to feel some irritation either in the knee or in the hip, etc., etc. So we don't want to be in that position all day, day in, day out, because the right muscles aren't being worked and the wrong muscles are getting too tight, okay? So we want to look at posture, we want to look at what your regular activity is and regular lifestyle is on a day-to-day basis. So we're going to assess that first. Next step is, once we identify what the issue is and what could be causing that, we want to start releasing all those tight muscles. So what's going to be tight? When we're talking about lower body pain and tightness and stiffness, from knees to hips to low back, we're going to be talking about muscles that are tight in the low back. So you have your quadratus and your back extensors. You have your hip flexors, okay? Various hip flexors, so different muscles. I'm kind of grouping these generally. You have your glute muscles, including your piriformis. You have your IT band, which that muscle itself is up in the thigh. There's a quad. You can focus more on the quads, focus more on the hams, depending on the individual. And then you have the tendon that runs from that the IT band, from the TFL into the IT band, down to the knee. So we want to work on releasing that inner thigh too. So inner thigh, TFL, and IT band, your glutes, your low back, and your hip flexors. Okay, so what's the best way to do that? Stretching is great, but before you stretch, you also have to release those tight muscles. So if you think about a knot, if it's always knotted, just stretching might stretch it out and loosen it up a little bit, but if we get in there with, say, some form of SMR, or self-myofascial release, or trigger point therapy, we're going to actually break that tight muscle, that knotted up muscle, down even better, so then we can stretch it from there, okay, and then work on our flexibility. So this is about flexibility and mobility. So what do we want to use when we do some SMR and trigger point therapy? We have a foam roller. This is a short one. I also have a long one. We can roll out inner thigh, IT band, TFL, hip flexors, everything in that lower body with a foam roller, with a great foam roller. Then we can also I don't have one with me, but a stability ball, or not a stability ball, a tennis ball or a lacrosse ball is great, because then we can get really into those glute muscles. We can actually lie down and get more deeper into some of your thigh muscles and the thigh tendons that we want to. So after that, then we can do some stretching. Then once we release those tight muscles, then we want to work the other muscles. If we do this the opposite way and we start to work the muscles that we want to strengthen before we actually loosen up the other stuff, you're not going to have as much luck, because your body just won't want to activate properly. So highly recommend your first step is loosening up the proper muscles. Otherwise, you're going to keep feeling things in the wrong areas. You can do this on a day-to-day basis. This whole series should be part of a day-to-day basis. So check your posture, check your lifestyle, check your mobility and flexibility, then activate, and then you can lift, okay? It does not have to be a long procedure. You can do 1 or 2 things for each one on a daily basis. You can spend longer periods of time if you had it to do this whole process. So once we are ready to do the activation exercises, we want to do things from side planks. So we want to strengthen our core, we want to strengthen our glutes, we want to strengthen the posterior chain, so some of those back extensor muscles, and our back, so that we have proper posture, because if we can't hold proper posture, then we're not going to be able to train heavy, we're not going to be able to progress, we're not going to be able to get the results that we want, okay? If you guys have any questions about this whole step-by-step structure and how to get yourself out of pain in that lower body, knee, hip, back area, please hit me up, fusionfitgym@gmail.com. I'm happy to write a program, virtually personal train or group train you, or even meet in person depending on where we are and our circumstances. If you guys have any questions, let me know. Take care. Give it a shot.